almost every disease is in some way related to four things: nutrition, physical activity, quality of sleep, and our stress level.
Dr. Erkeda here with Dr. Sejal Desai, and I'm just going to let her introduce yourself and tell us a little bit about your journey to medicine.
Hi, and thanks for having me. I'm so excited to be here and talk with you and the students. So I've been a family medicine physician for about 20 plus years. I did my training in Michigan, but I've been in Texas most of my life. I thought in medical school, I thought I was going to go into pediatrics because I loved kids. But then as I started doing my rotations, just kind of realized, I like kids and adults. So family medicine was kind of the natural choice for me. I trained in Michigan, like I said, and I've always been interested in preventive medicine. That was kind of always been my focus. And a few years ago, I came across this practice of obesity medicine, and I can talk a little more about that in a minute. But that really was where I realized this is my true calling. And I became board certified in the field of obesity medicine, and started my own practice, was doing family medicine and obesity medicine for a few years until COVID hit. And then I felt really overworked, overburdened, like a lot of us in medicine, I think. And I felt burnt out with everything that I was trying to do. And so I took some time off. I really just left everything, and just took some time off for myself and to kind of figure out what my next path would be. And I knew that I loved obesity medicine, that I wanted to focus on that. So I opened up my own virtual telemedicine practice, which is what I have now. It's called Tula Medical Weight Loss and Wellness. And I focus on helping patients lose weight. As an obesity medicine physician, we take a preventative aspect towards weight. We look at the whole patient, comprehensive approach, including medical history, lifestyle, mental health, all of those things. And then we work to develop a personalized treatment plan that could include lifestyle modifications, medications, weight loss surgery, any of those things to help our patients. And this has really been like happy medicine for me, is what I call it. I really finally feel like I've found my passion. I think it's happy medicine because I'm happy with my career choice. And I think the patients are too. They feel energetic. They feel like themselves again, overall, just mentally and physically happy. So it's been great. And I'm just enjoying life at this point. I also get to do a lot of other things. I, just started an online entrepreneur physician group. I am, on the board of the Houston Obesity Society. So I do a lot of just kind of work, training, podcasts, things like that to spread the word about obesity medicine as well. So it's been fun.
I love that. And that sounds like such a fun journey. I can definitely identify with you because I'm also a family physician. And like you were talking about, a lot of our students who are listeners are either thinking about going into medicine and what will they become, or they're at that point where they're in medical school and they're trying to figure out which specialty. And sometimes it gets to that point where you're like, okay, should I do internal medicine? Should I do peds? I like both. Or can I combine it? Should I do med peds or family medicine? And finding out where you fit can be something that people love to explore in those things. But one thing that I love that you shared about family medicine is there are so many phases that you can have with it. And when you feel as though you may not necessarily love one component, you can reinvent yourself and still work to serve and help patients.
Absolutely. I think it's okay. These are one of the things we learn as we go through, right? Like it's okay to pivot and shift your life a little bit if you're able to, and sometimes what we start off with is not where we end up in life, but that's life, right? It's okay to just roll with the punches. And I think that that's okay in medicine as well.
Absolutely. And I love that you said that, like everything, like we love to think of it as kind of like a linear journey, but it's actually like a lot of pivots and turns and U-turns and all of the different things. And that's okay. Like we don't have to have everything mapped out.
That's right. We don't. Actually got a tattoo that says that. It's
Oh,
the
that's so
bottom of
cool.
my tattoo is a unilome. The unilome is basically our life's journey. It's not a linear path, just like you said. It's, goes in crazy waves, and eventually we get to that point that leads us to, where we're supposed to be, I guess.
Yes, I think that's so cool that you have that tattoo, because it definitely rings true in a lot of realms of life. And for the students out there who may be thinking like, my life is not necessarily my own right now. Like you're on this schedule, you're studying, you have to show up to your rotations and your clinics and things like that at a specific time that you can't necessarily change or say no.
Yeah.
But when you're in attending, you can get to that point where you kind of figure out like what's right for you and where you want to go. And if you want to do pivots and things like that, you mentioned that around the start of the pandemic, you were getting burnt out and you decided to get an extra certification and start a new journey. How would you recommend that those who are in their particular position right now in terms of being in school and not having as much control over certain things work through those sensations where they may not feel as though, and I hate to kind of call it burnout because they've heard my rant. Burnout isn't necessarily like my favorite word just because it kind of puts the pressure on you, like something's wrong with you. Why are you not able to sustain this pressure that a lot of people may be facing when in actuality is kind of the system that they've kind of trained us in, where we have these expectations that may not necessarily be realistic, where you are giving your everything and you of course are serving patients and living up to your oath, but some of that can take away from your personal life or your family life and things like that. How do you recommend, I guess, getting to the question, that students kind of navigate that sensation of feeling overwhelmed or burnt out or not enoughism at this point?
Yeah, I think that that's such a good question to ask. And I agree with you. Burnout has such a negative connotation, right? It really does, because I truly believe that our choices are our choices. We get to decide. In medicine, unfortunately, we are led down this path sometimes that we're told what to do for so long that, you get to a point and you're just like, well, I have to do this because this is, this is the path I have to take. Well, it is not always, that. I think it's important to take some time and really focus on ourselves and really take time to think about what is it that we want, right? We hardly do that. We, as medical students, as residents, as doctors, as women, as moms, as whatever, right? We sometimes just forget to really go back to really looking at, am I happy with where I am and what I'm doing? And I think that's the kind of shift I had to make at the pandemic. And, I had read this book at the time. It's by Jay Shetty. And if you don't know Jay Shetty, he is like a motivational speaker, but he used to be a monk for many years. And he wrote this book, Think Like a Monk. And he talks about this concept of dharma, Dharma. Dharma. It's a multifaceted concept, but it's really about figuring out our place in the world and then using our gifts to make it a better place, So I think going back to figuring out what is your dharma, which encompasses what's your calling, how are you giving service to others? Are you practicing ethical principles, and this journey of self-discovery. So taking some time every once in a while and just reevaluating where we are, why we're doing what we're doing, because in medical school, we can kind of lose that. You just get caught up in all that is put upon us, and it's a lot sometimes, but really taking a step back and kind of realizing why you're doing this. And if it's truly what you want to do, continue forward with it, but don't lose sight of why you're doing it. Your skills and your passion is your dharma. And if you are practicing your dharma in daily life, then I think that, you are on the right path. And if you're not, then think about, changing paths, and it's okay to do that.
I love that. It definitely all just boils down to your who and your why. Like, who are you? What are your core values and what do you want to do with your life? And then your why. Like a lot of times especially during these phases where you're transitioning into medical school and applying and you're transitioning into residency. You have to write a lot of personal statements and things, kind of getting down to your why. And I love to tell people, like, look back at that, like in those hard times, because although it may change in terms of what you think your goal is and where you want to be and all of those things that come with life, usually the core and the essence of why you're doing this kind of stays the same. So kind of do that self-reflection and figure out what's right for you instead of moving in terms of what other people may want for you.
Yeah, exactly. I mean, how many times in medical school and even residency, do we want to just say, especially internship year, you're just like, I don't know why I'm doing this. I don't want to do it anymore. I want to quit. It's really easy to get to that point because we feel that overwhelm. So I think that, we understand that for those that are going through it because, we've been there, but if you're really on the right path at the end of it, you will be thankful. There is an end, because once you get done with all of that, then you get to practice the way you want to practice. I think so many times when you talk to doctors, they're unhappy in what they do. And I think that's discouraging to our medical students and residents because if we're unhappy in our fields, then what is the point for them to go through this, right? Why work so hard? Why do this even? But I think the unhappiness comes from not knowing what you truly want and then practicing that. So it's, if we can start that self-reflection, like you called it, early on in medical school and kind of have that goal in mind as we're moving forward, I think it really will help, make the whole process easier.
Absolutely. I couldn't agree more. And a lot of these things we're talking about are kind of like, how they say hindsight's 2020. If you could like restart your career, like what are three things that you wish you would have known when you were first starting out?
So that's a great question. There's so many things, right? Because like you said, hindsight is 2020. But one of the biggest things I would say is that bedside manner matters more than our grades because we get so focused and grades are important. Don't get me wrong. Obviously, if you're in med school, you're probably making good grades, or if you're trying to get to med school, you're making good grades. In med school, you have to make good grades to get to residency, but it's not everything. I mean, when you get to the end of the day, our patients don't care if we aced every test in medical school, if we graduated with honors. They do care about, how closely we're listening to them, how much we actually care about them. And, I've noticed sometimes it's just vulnerability. Like I've learned that it's okay to say, I don't know, but I'll get back to you. I'll look it up and I'll get back to you on that. So being honest with them, they appreciate all of that so much more than your accolades. So I wish I would have known that early on because I would have, I think I would have focused a lot more on other things at that time. So that's one big thing. And I would also say that, I learned through these years that medicine is not just about helping patients, right? It's not, I just thought, I'm going to get to just go and help patients all day long. And then I'll go home and I'll be with my family and it's going to be great. Well, there's a lot more involved to practicing medicine, right? We have, after you're done with your patients, you have documentation and reviewing labs and imaging and prior authorizations for medications. And there's tons of stuff. And so we need to take that into account when we're looking at what our lives are going to look like as physicians. We need to take all of that into account. You're the time you're seeing patients, but your admin time, which we don't get paid for, but the admin time is also your time. So don't forget about that. I felt like, sometimes, especially at the beginning, I was just spending so much time, even more time on doing all those other things than actually seeing patients and then getting frustrated because I never realized that we need to really, as doctors, we're doing all of those things. All of that is our job, So I think that's important. And then just the third thing I would just say is I never realized what a huge role lifestyle plays in disease, So almost every disease is in some way related to four things: nutrition, physical activity, quality of sleep, and our stress levels, right? So if we learn this early and if we fix these things early in life, in many instances, we can fix a lot of the problem. And that is for our patients and for ourselves, right? Learning that for ourselves. I wish I would have learned that and prioritized all of those things. Sometimes you can't. You're in medical school or residency, and sleep is, not always highest priority. But I think that, overall, if we can learn that for ourselves and for our patients, I think that would, really be helpful, knowing that early on in our careers.
I couldn't agree more. And just to reiterate what you said, I think I definitely agree. Like sometimes I think we get tunnel vision, especially like with grades and all of those kinds of things, but it all goes back to that why. Why are you seeing these patients in the end game? Like you want to make them feel better. You want to have them feel heard. You don't want anyone to leave your office and say, oh my God, I had a horrible experience. I never want to go back to them, or they didn't listen to me, or they gaslit me. So definitely, even if it's like one of my mentors told me that you may see 10 out of 20 people may be diabetics in your day, and never get to that point where you're like, reading a script like, oh my God, another diabetic. Each person is different. Each person has a lived experience that's different, and everybody has a different disease process and the way they're processing it and medication. So make sure that you are treating people as people and putting yourself in their shoes. And then the second part where you were talking about like the business of medicine, like they don't teach us enough of that in school. And you get there and you're like, wait a minute, my job is to help the patients. Yes. In theory it is, but there's a whole lot of other stuff. So hopefully like your generation coming forward can definitely advocate to get more resources so that you will not be spending another 5 hours after clinic documenting and doing all of those things, so you can prioritize other stuff. So maybe you can advocate for having a scribe, or AI is coming. Who knows what tech changes we'll have in the future, but working on learning those things in the process and the business of medicine is important. Also to figure out where you want to do and what kind of medicine you want to practice, whether or not you want to have a private practice or a DPC or work in a hospital or a surgeon. Like all of these different things kind of come together. And then the third part about just prioritizing wellness and prevention is so important. We don't learn enough about it. Like you have your obesity medicine certification, even though we trained in family medicine, I have a lifestyle medicine certification. So there's so much more out there for us to learn about how the body works and how we can make it do better to prevent the diseases that we're treating. So not only learn that for your patients, but for yourself, so that you can have a healthy, well-balanced life.
Yeah, you summed that up really well. Exactly.
we're just like, we're vibing because it's so important, and figuring out that work-life balance. Do you even think like that it's possible to have work-life balance both when you're a student and when you transition into being an attending physician?
Yeah. So, that's a great question, because I hear, doctors and everybody saying that a lot. It's not even possible to have a work-life balance. And I couldn't disagree more, because I think there's a few things that we do have to pay attention to when we're seeking work-life balance, right? And first of all, it's communicating well. So setting expectations, with our patients, with our colleagues, setting those expectations that this is, whether it's the times you're working or when they're allowed to contact you, setting clear expectations around that and communicating it is important. The second thing is delegating tasks. And this is admittedly something that I'm still working on daily, because we can't do it all. Most of us, a lot of us, feel like only I can do my job. No one else can do it, better. But that is absolutely not true. And so learning how to delegate is key, having that time for ourselves. And so figuring out who and how to really delegate, I think is extremely important. And then the third piece of work-life balance for me is scheduling the downtime, right? Scheduling it. We do things that we make priorities. And so if you make your personal hobbies and your self-care a priority, then you will do it and accomplish it, right? And so for me, it's like putting it in my schedule. My, workout routines are in my schedule. These are the days I'm working out. This is exactly what I'm going to do. And this is the amount of time, like really smart goals, the way they say this, set goals to be specific, measurable, attainable, reliable, and time specific. So set those goals for yourself, write it in your, your calendar or whatever, but make your self-care a priority. And then you will find that time. So is it always going to be possible? Maybe not. Maybe there are times when you're going through, your final exams or something where you're having to sacrifice a little bit, and that's okay. But when you make this a priority, then most of the time you're doing all of these things, your personal self-care and your hobbies, whether that's traveling or photography or art or whatever that may be, reading. Don't forget about it. Don't forget about it just because we are in medical school or we're in residency. Maybe it's once a month you get to do it, but you have it, you're doing it, on a regular basis. You're continuing to do that. So I think if we can do those three things and set our boundaries, then I think we can absolutely have and work towards. I'm working towards it daily to have a work-life balance.
Absolutely. I couldn't agree more. You have to schedule it and kind of hold yourself accountable and still do the things that make you, because there's so much more to you than being a physician. Like, that's a part of who you are, a component of it, but it doesn't define you. So keep those parts and kind of set those boundaries. So that's just so important.
Yeah.
So our interview is coming to a close, and I've had so much fun chatting with you. One of my final questions for you, I love to ask my guests, because we get so many different types of answers. We all know that the healthcare system is a special place. So there are a lot of things that we can do to make it better. If you had a magic wand and you can change anything about the healthcare system, what would it be?
So if I had a magic wand, I think in this country, our focus is on treating disease. We're not practicing healthcare, we're practicing sick care. And so honestly, I'd want to shift that focus back to prevention. Of course, we need to, treat the diseases and know how to do all of that. But if our focus is on prevention of disease, and particularly the 4 pillars, and as lifestyle medicine, I think you can agree with me on those 4 pillars I talked about earlier: nutrition, physical activity, sleep, and stress. If we can, have a healthcare system that's focused on that, and that helps patients, whether that be through, coverage of services and medications and all of that, all the way through helping patients really understand and get the knowledge and education behind all of this as well. That's where I would like to see, our whole country, our whole world, the whole globe really changing to focus on all of these things that we know can have a huge impact on the quality of our lives, our well-being, our mental and physical health. So that's what I would say.
I could not agree more. Well, it was so wonderful for you to join us on the show. I just want to give you an opportunity to tell our audience goodbye and where they can find you.
Thanks so much for having me. This was wonderful. Yeah, you can find me on my website is www.tulawww.com. On social media, on Facebook, Instagram, you can find me at Tula Medical Weight Loss. And then I'm also on LinkedIn, Sejal Desai, MD. So please feel free to reach out. I love connecting with medical students. If you have any questions on obesity medicine or just medicine in general, I'd love to chat, and I'd love to find out what you guys are doing and how things are looking nowadays. I'd love to chat about that.
Well, thank you so much. And for all of the listeners out there, feel free to share this episode. We're also on YouTube now, so you can check us out on Med School Coaches YouTube. And if you have any requests for any specific topics or guests, you can reach out to me on my Instagram at Dr. DeGram, DOCTOR, the letter DGRAM. And let me know. I'll see you again next week with another fantastic guest. Bye.
Each episode of the Prospective Doctor podcast is brought to you by Med School Coach. To access articles, videos, webinars, and free tools to help you succeed on your journey toward med school and beyond, visit our website, prospectivedoctor.com. We hope you tune in again next time.